If you look at the dismal data on engagement rates in this country, they're terrible. Like, only a third of employees are engaged, and it hasn't changed in 30 years. For the healthcare costs, there's a really great organization, nonprofit called Health Rosetta, that Dave Chase and colleagues have started, and he wrote a book that I'm going to mention this morning called The CEO Survival Guide, Why Healthcare Costs Are Killing Us and How to Restore the American Dream. And Health Rosetta has really been on this mission to look at how do we actually reduce healthcare costs. And so they look at working within geographic areas and really looking at the quality of care and looking at how do you create plan designs and create care models that encourage employees to actually go seek the high quality care and carve out the doctors and the providers that really don't have good outcomes. They've been training brokers, they've been training salespeople to really look at how do we take the strategy and say, we have to fix it at this level, and looking at the overhead and just how, like, for example, brokers are typically paid, and they're really just trying to disrupt in an effective way to more humanize and be effective in that space. And they have some great examples like Rosen Hotels. I mean, their people are very low paid and they're high utilization and they have high risk and all these types of things. And what Rosen Hotels did is, in implementing some of these Health Rosetta strategies, they were able to literally cut some of their costs in half. And then what they did is then they reinvested that back into education funds for their employees, driving them to and from visits, like really richly investing in benefits and investing in the things that actually matter, like their social determinants of health, building up communities around them. It's really cool to see this movement growing with organizations are finding real solutions for healthcare costs and then being able to take that savings and actually invest it back in to the well-being of their communities, their employees, and the things that actually determine their health and well-being. And then from the organization standpoint outside of healthcare costs, then Gallup has done some great research that's been leading the way in this space and has found that just because well-being or health and wellness is not a insurance cost savings mechanism, that it profoundly matters. So they've looked at when people are both thriving in all areas of their well-being, so career, social, financial, emotional, physical, community, and they're engaged at work, it makes a big difference.